Good morning, everyone. Yes, it's me again. So it should have been Gabriele Puller. She wants to greet all of you very, very much. She's the brain and the heart behind EB Clinet. And yes, I show her, I want to just give you a glimpse of her work. Well, EB Clinet is all about connection, communication, and collaboration. We thought about how can we bring all these people together who know about EB in the medical areas, nurses, doctors, therapists, and others. We know we have Deborah, we have many other organizations, but we thought it might be good to have something more. Because the experts are very rare, are as rare as the disease, which is, I think, a good, and they are more rare than the disease. And all those who know about EB, they all have to learn more and more and more, because there are new developments, new ideas, but if you are in one country, you're sitting in your private practice or in your hospital, you have to work all the time, and you don't have only EB patients. I think it's only me who is just doing an EB outpatient unit. All other medical doctors are working with many other diseases, many other patients. They simply do not have the time just to look over the new developments every week or every month. So if there is a new development, it would be fine to get it somehow without looking for it. And this is one of the ideas behind EB Clinet. We want all healthcare professionals to be connected, because they have to talk to each other, which is also not that easy as you might imagine. It's not just, no one in a normal hospital has the time to talk to all the colleagues he wants to talk all the time. So we simply have to do some work. And what we also need is more people in this field. And how can we reach these people? How can we talk to people who might be interested, but we do not know that they are interested, or we do not know that they already know some EB patients? So how can you find these people? These were all questions we wanted to, we wanted to take the challenge and try to find something. And of course we want all the patients who ask for help to find someone who can help them. But it's not that easy, as we heard a long time. It's also not easy in countries like Austria and Germany. In Austria, we are a small country, and we have a very good advertisement from Deborah Austria. So many Austrians know now about EB. We've sent letters to all pediatric departments, all neonatology departments when we started the thing, just to inform them there is someone. If you ever have a baby with blisters, you might want to ask. And these were the starts, and now it's well known in Austria. So if there is a baby with blisters, someone is calling from the department, the EB house, which is nice. But it's not the same in Germany. We have families, they wait for 1 year to get the diagnosis, even though they have wonderful EB specialized centers there. So how can we have this done? And EB Clinet wants, of course, not only connect people, but the main aim is to help the patients, just to bring them to the specialists they need for their disease. So yes. So what can EB Clinet now provide? It can provide information, worldwide contacts, also this one I think that Gabi really likes, this collective swarm intelligence. So one doctor knows something, and a patient knows something, nurses know something, but all together we know more if we talk about these things. And we want to, or we already have now, group-specific mailing list. So if there is a question, for example, for dental care, there is a special question a dentist might have. He can send the question to EB Clinet, and EB Clinet sends it out to all the other dentists that are in the list. And EB Clinet is really trying to get this list updated. So they ask every half a year, everyone who is in the list is asked again and again if he's still doing the work, if he's still in this job. There are nurses who have been there, who have a lot of knowledge, but they are not no longer working in EB, and it doesn't make sense to have a dead list. So we want to have a lively list with people on the list that are really working in EB. So EB Clinet, which is in fact Gabriele Pola and her two assistants, Julia and Iris, they are updating these lists all the time. You can't imagine what a huge amount of work this is, but I think it's worth it. And they started just with the personal contacts from the Debra clinics, but then we ask patients, and if a patient tells you, well, I found a dentist who really helped me a lot, we sent them maybe the guidelines, and then he talked to another doctor with EB, and then now he had 2 patients with EB. Well, then he's in the in the hands of EB Clinet. He will get an email. Do you want to join us? What can you offer? Would you be able to treat other patients too? And then there is the collection of data where you can fill in. You do not have to. Some doctors are then in fear. Okay, will now every EB patient in the world come to my clinic? So I can't do this because I have so many other patients. How will I? So he can say, okay, I might be able to do a little more, but I can't be at conferences, or I'm interested in conferences. So there are lots of questions you have to answer to be part of Clinet. But we are welcoming everyone who is just wanting to do just one thing or 2 things for EB patients. And so we get now more and more connections. And they made a lovely thing, these interactive maps. If you have a look at the EB Clinet website, you would see that you can click into a country and then you can see what's provided in this country. Yes, and they make these annual updates. So if there is any doctor, any nurse who gets these emails, please don't ignore them. Don't let them go down. Just take the 10 minutes to fill in the questionnaire again, and then you stay on the list. We had to put some people off the list because they never answered. They never answered any questions. They just wanted to be in the clinic. They wanted to have their wonderful sign. Well, we are an EB center, but if in fact they never answer any questions, or if we send patients to these, if we ask patients, just connect with these. I get an email from, let's say, from Italy, and I tell them, okay, your nearest center is there and there, and please ask there first. Then they write an email, can you help me with this and that? And then after a few weeks, if they don't get any answers from these centers, we ask them, why did this happen? And if we also don't get answers, we simply put them off the list, because it's not. We want people who are really engaged in EB, and not people who just want their name on a list. So, and Gabi is very, very clear with this. She knows nearly everyone in the EB world, which is really nice, because she also calls those people. She calls them directly, asks them, what about you? Why are you not answering? And then it might be that the person was ill for 3 months. This happens to doctors too. So maybe he was really not able to answer, but wants to stay on the list, and he gets a second chance, of course. But if not, if he says, in fact, well, I did this small research project years ago, and it was very interesting, and I liked it a lot, but now I'm a, let's say, plastical surgeon, and I can't do anything more, then, well, he's off the list. This happens, which is very important to know for doctors and nurses and everyone who is healthcare professionals. We don't put the names and the private email addresses of these people at the list, because also we as healthcare professionals, we have lives beside our professional life. We don't want anybody in the world to find us anytime. So we also need some breaks. So we just there is an anonymized EB Clinet address on every page, but we know who is the one who is behind the address. You will not know it as a patient at first. You will know it as soon as you get an answer, but not at the moment when you write the email. But this is just to protect the people who are there. This is also something that's needed, and I think it works quite well. But as soon as you get no answer from this address, please let EB Clinet know. They will find out why you do not get an answer. Well, so this is what EB Clinet can offer contacts to many, many healthcare professionals in many, many countries. They can offer that you ask your question, then they send it to people who might be able to answer questions. And at least if no one is answering, I always get these questions. So I hope that my colleagues are really trying to answer more and more and more. But at least you will get some answer. The problem is that we can't answer many questions. You know, we know a lot about EB, we learned a lot about EB, but there are so many things, especially for daily life, we are not able to change, to do something about. But what we can do, we will provide. Well, and at the moment, there are 88 partners in 58 countries all over the world. So I think this is a big achievement in the last years. There are many more countries that need many more specialists. So if I, for example, look for your countries, if you look at India and China, there are already 1, 2, 3, 4, 5 people in this EB Clinet, but this will not be sufficient for everyone who is living with EB in this country. So we need many, many, many more. And if you know any doctor, any nurse, any therapist, occupational therapist, whatever, dentists, you know one who is really wanting to help and and this is already helping EB patients, just get him in contact or her in contact with the EB Clinet, and he might be well able to be another partner. And I hope with the time we can then do much more for all our patients all over the world. Yes, and that's Gabi's farewell. Together, everyone achieves more. Let's be a great team and work together, all together in EB. Thank you.